Uh, Hello and welcome back again. My name is Jay Shah and I currently work as an intern. Today we'll be discussing the MCQs of Pathology Paper 1 from summer 2013 to winter 2019. So there'll be approximately 16 papers, 14 to 16 papers, and we'll discuss each of them in a very brief manner. And I hope that many of the MCQs would get repeated, even if in paper 1 and 2 they have not been repeated. So let's start without further delay. So we'll start with summer 2013. So in cell injury, the word that means falling off or drooping off is apoptosis. So it's a no-brainer. Before going further, I would like you to watch the first two videos of cellular injury, adaptation, and cell death, as well as inflammation, which I had recorded previously at 1.5 to 1.7x, because many of the questions would be repeated again. So here my primary focus is on neoplasia, amyloid, immunology, and blood disorders, basically those affecting RBCs, WBCs, platelets. So the cell injury, the word that means falling off or dropping off is apoptosis. Type of amyloid seen in plasma cell dyscrasia. Now plasma cell dyscrasias are basically because of light chain amyloid. So it is AL type. A beta 2M is associated with chronic hemodialysis. AA, beta amyloid AA. And finally, you have ATTR, which is amyloid transthyretin receptors, which is seen in generally thyroid cancers. Heart failure cells seen in which of the following? It is seen in the lung. Though the name is heart failure cell, it is seen in lung. Yes, cells are generally seen in the lung because they are basically due to left heart failure. So in left heart failure, there's pulmonary edema, there is transudation of fluid, and RBCs. These RBCs are engulfed by macrophages, and the hemoglobin inside the RBCs is broken down into hemosiderin, which is basically collection of ferritin. So when you stain it with Prussian blue, it will appear blue, right? So these are basically your heart failure cells. Heart failure cells are hemosiderin laden macrophages. Don't forget that. Abundant collagenous stroma in neoplasia is referred to as, it is known as desmoplasia, right? It is known as desmoplasia. Remember it. Choristoma. What is choristoma? There are two terms, choristoma and hamartoma. Hamartoma, remember from the word hamara. Yeah, hamartoma means a group of abnormal cells, a group of cells at the same location or indigenous to the original site, such as you can have a stomach hamartoma, that is a group of cells in the stomach which may form a polyp, but they, when you see this cut section, it will be cells from the gastric mucosa itself. You can also have a choristoma. What does choristoma means? Choristoma means a ectopic rest of normal tissues. One of the most common choristomas is pancreatic choristoma. You can find pancreatic tissue at some other location. So hamartoma is normal location, abnormal cells. Choristoma is basically abnormal location, normal cells. Huh. In TNM staging, N stands for, so T is for tumor size, N is for nodal metastasis or nodal involvement, and M is for distant metastasis. So N is for lymph node involvement. Deficiency of factor 8 causes hemophilia. So hemophilia A is factor 8. Hemophilia B is factor 9. And right. Tigroid appearance of heart is seen in tigroid appearance. It's a no-brainer. You'll have to remember it is fatty change. You'll have alternate bands of yellowish and brownish heart. So that appears as a tiger. So it's known as fatty change. Why? Because heart generally uses fat as its source of energy. It does not use glucose. Right. Autosplenectomy is a feature of autosplenectomy is generally a feature of sickle cell anemia. You need to remember that. One sec. Right. Now, Philadelphia chromosome is seen in chronic myeloid leukemia (CML), translocation 922. Remember it. Process of engulfment of solid particles is known as phagocytosis, and it was discovered by a scientist named as Mechnikov. Now, why am I telling you that? Because this question has been asked that the scientist who discovered phagocytosis was. So they had given multiple options, Virchow, Celsus, and things like that. So the answer is Elie Mechnikov. Elie Mechnikov discovered phagocytosis. Process of red infarct is usually seen in. Now this question is also repeated multiple times. There are two types of infarct: red infarct and pale infarct. Red infarct means you have an abundant capillary network. So in lungs, you have an abundant capillary network. In your ovaries, you have an abundant capillary network. In your intestines, in the crypts, you have abundant capillary network. So all of them will have generally wet necrosis or a wet infarct. It will not be a pale infarct because there is plenty of fluid there. Whereas in solid organs, your spleen, your heart, your liver, your kidney, all of them are basically solid organs. So you'll have a pale infarct. So pale infarct are generally seen in heart, yes, kidney, yes, spleen, yes, not in lung. So in lung, you'll see a red infarct or a wet infarct. Here you'll see a pale infarct or a white infarct. Pale is white and red is basically wet. What is blood group of person with anti-H in serum and no antigen, A, B, and H on the red cells? Now, see, anti-D is specifically for O antigen, but they have mentioned anti-H. So here the answer would be Bombay blood group. Bombay blood group means at H antigen positive, uh, sorry, H antigen negative, they'll have anti-H serum and they'll not have A, B, or H antigens, right? Bombay blood group, remember, it is related to absence of H antigen. Defect in intrinsic pathway of coagulation is detected by, so the answer is activated partial thromboplastin time. APTT is the answer. PT is generally used for extrinsic pathway, right? Intrinsic pathway is APTT, and your bleeding time is basically with reference to your platelets. Deposits of antigen antibody complex on GBM, glomerular basement membrane, they are detected by, you cannot see with the light microscope, not with dark ground, not with polarizing. You'll have to see it with immunofluorescence. Right, so GBM, you'll have linear deposits. Best example, Goodpasture disease, right? Immunofluorescence. Commonest cause of microcytic hypochromic anemia is iron deficiency anemia. True tumor arising from pluripotent stem cell is, the answer has to be teratoma. It is not generally embryoma. We'll say it is teratoma. All right. Nutmeg liver is seen in, it is seen in CVC liver. Now, three CVCs are very important. CVC spleen, CVC liver, and CVC lung. So in CVC lung, you'll have heart failure cells or hemocytin-laden macrophages. In CVC liver, you will have three stages, which is a periportal zone of normal hepatocytes, a central zone of necrosis, and a mid zone of fatty change. And you'll have CVC spleen. In CVC spleen, you'll see gamma antibodies, which are basically foci of dystrophic calcification. So nutmeg liver, CVC liver. All of the following are examples of granulomatous inflammation. Tubercular leprosy, yes. Sarcoid, yes. Schistosomia, yes. Giardia, no. Giardia is basically an acute vaginal infection, which is giardiasis. Following is true about fatty change of liver. Now, this question has also been repeated many times, so let's have a look. Alcohol abuse most common is the common cause, yes. Now it is non-alcoholic steatohepatitis, commonly called as NASH. Often reversible, yes. Fat is demonstrated by staining frozen sections, yes. Predominant accumulation of cholesterol, no. It is predominant accumulation of triglycerides, and triglycerides are not cholesterol. Okay, so the answer is yeah. D. Three primary influences on thrombus formation, virtuous triad. Virtuous triad is three things. Triad is three now. So first is endothelial injury. Second is alteration in normal blood flow. It can be a sluggish blood flow, it can be an altered blood flow or a dynamic blood flow. And third is defects in clotting factors or basically hypercoagulability of blood. And you can safely write factor V Leiden deficiency in hypercoagulability of blood. Example of oncogenic RNA virus is your HTLV1, human T cell leukocyte virus 1. HBV, EBV, HPV, all of them are or DNA viruses. Yes, HBV, hepatitis B virus will cause hepatocellular carcinoma. Epstein-Barr virus, generally it causes nasopharyngeal carcinoma. HPV causes warts. Warts and 6 and 11 will cause warts and 16 and 18 will cause cervical cancer. Granuloma is a focal accumulation of activated, what is it? It is activated macrophages. Yes, right. Activated macrophages and TB, they are known as histiocytes. Remember it. Slipper-like nucleus. Congo red staining, amyloid shows yellow green or apple green birefringence with, the answer is polarized light microscopy. Keloid is an example of excessive scar formation. So excessive scar formation is keloid. So there's a difference between keloid and hypertrophic scar. I need to go through that. Macrocytosis correlates with macrocyte, means the cell volume is increased. So your mean cellular volume will be increased. So the answer is MCV. It does not have to do anything with PCV. It is basically MCV. Gons focus and lung. Now two things: Gons focus, Gons complex. So Gons focus is basically uh, involvement of lung parenchyma. That is a Gons focus. Now involvement of lung parenchyma plus its draining lymphatics and plus its lymph node, perihilar lymph node, that is known as Gons complex. So Gons complex is Gons focus plus lymphatics plus perihilar lymph nodes. So it is generally seen in upper part of lower lobe or lower part of upper lobe. So upper part of upper lobe, no. Is it seen in lower part of lower lobe? No. Upper part of lower lobe? Yes. Upper part of lower lobe. Bleeding time is a marker for, generally it is a marker for platelets. Clotting factors, no. Bleeding time is a marker for platelets. Hemophilia A is transmitted as, it's an, which type of disorder? Hemophilia's X-linked, X-linked recessive disorder. Following is true about typhoid. Typhoid is a type of acute inflammation. Now, typhoid, you need to remember that it is acute inflammation. So normally you should see leukocytosis, but in typhoid you will see leukopenia. Leukopenia with lymphocytosis. Remember this sentence, typhoid is an example of leukopenia with lymphocytosis. Caused by Salmonella typhi, yes. Hypertrophy of PS patches, yes. Peripheral blood shows neutrophilia, no. It shows lymphocytosis and leukopenia. Ileal ulcers are longitudinal, yes. Ileal ulcers will be transverse in the case of tuberculosis. So transverse will form strictures. That's why in TB you will have strictures. Whereas longitudinal ulcers are seen in typhoid, and flask-shaped ulcers are seen in amoebic colitis, right? They are seen in the large intestine, colon, amoebic colitis. Endothelial activation and injury with vasodilation and activation of cytokine cascade is principal mechanism of. So vasodilation and endothelial injury, you'll have some agent which is damaging your endothelium. So it has to be, the answer has to be septic shock. It is not hypovolemic, cardiogenic or neurogenic, it is septic shock. And septic shock is known as warm shock. Why? Because there is peripheral vasodilation because of cytokines. Basically, there is inflammation, whereas hypovolemic shock, neurogenic shock, all are examples of cold shock. So the answer here is septic shock because your peripheral vessels are contracted in hypovolemic shock. Anticoagulant used in blood bank for blood donors unit is, the answer is oxalate. You use oxalate, adenine, and dextrose. Dextrose is sugar, adenine, and you'll use oxalate. Sorry, my bad. It is citrate. It is CAD. Yeah, citrate, adenosine, and dextrose. So 15, the answer is yes, it's citrate. Several skeletal injuries may result, severe skeletal injuries may result in. Now, long bones generally have a lot of fat. The marrow is replaced by instead of hematopoiesis, there is accumulation of fat. So it is a fatty marrow. So a skeletal injury may result in displacement or dislodgement of that thrombus to form an embolus. So that can be dislodgement of that fat to form an embolus, and that is basically known as fat embolism. So skeletal injuries, fat embolism. Right. So now we'll move further to the next set of questions. Yes. Summer 2014, metastatic calcification primarily affects. Now, two types calcification. You can watch my previous videos, dystrophic and metastatic. Dystrophic is dead tissues, damaged tissues, aortic valves, atheromas. Metastatic calcification is there is some primary pathology which is increasing your calcium levels, such as hyperparathyroidism. And that is being deposited in normal tissues. And the most common normal tissues are your lungs, lung capillaries, kidneys, and your gastric mucosa. So metastatic calcification primarily involves gastric mucosa. Tubercles generally seen in TB, again dead tissue. Caseous necrosis, you will see dystrophic calcification. Atheroma, dystrophic calcification. Aortic valve, they generally degenerate with time, again dystrophic calcification. Pigment deposited in brown atrophy. Now brown atrophy of heart or brown atrophy of brain, pigment normally deposited is lipofuscin, also known as wear and tear pigment, generally deposited in perinuclear location. Perinuclear, brown colored pigment, wear and tear pigment, lipofuscin. Gravid uterus is an example of, now see what happens in a gravid uterus. Firstly, there is endometrial hyperplasia. Not endometrial, it is myometrial hyperplasia because estrogen stimulates your myometrium to form that. So there is myometrial hyperplasia, followed by that, as the fetus increases in size, there is stretch of these muscles. So stretch will result in hypertrophy, right? So gravid uterus is an example of hypertrophy more than hyperplasia. CCL4 causes, now CCL4 is it is a carcinogen for the liver, and that basically causes decreased synthesis of apoproteins. So there is a fatty change. There is no proteins for taking them. So there is fatty change. It is not inhibition of fatty acid oxidation. It is increased fatty acid oxidation, decreased fatty acid mobilization. So fats will accumulate there. There will be fatty change in the liver, and followed by then that there may be other changes. Altered mitochondrial function, no, it's not related. Process of leukocyte accumulation at periphery of vessels is known as. Now this question is from the cellular events of inflammation. So it is first it is margination, rolling, adhesion, diapedesis, chemotaxis, and phagocytosis. So what is it? Margination, rolling, adhesion, diapedesis, or transmigration, chemotaxis, phagocytosis. So process of leukocyte accumulation at periphery is known as margination. Through selectance, which is on and off attachment is rolling. Definitive attachment is via integrins, which is adhesion. Transmigration, also known as diapedesis. Leukocyte rolling, again, the same question. Leukocyte rolling is facilitated by selectance because these are weak bonds. Integrins are strong bonds. Prostaglandins cause the following effects of inflammation: vasodilation, fever, pain. Yes, they do cause all of the above. It's all of the above. Skin blister resulting from burn is an example of. So in burn, basically there is denudation of skin. So there is increased loss of fluid, but it is basically a transudative nature. So transudative fluids are generally serous fluids. They are low in proteins. One second. They are generally low in proteins, right? The answer is B, serous. Fat from vernix caseosa is seen in. Now that will be seen. Vernix caseosa is seen in the skin of the babies. Basically, that is known as vernix caseosa. Generally, you will not see fat there, but if you see fat there, that is an indication of amniotic fluid embolism, right? Which of the following hypersensitivity reaction characterized by fibrinoid necrosis of vessels? The answer is type 3. Why type 3? Because in type 1, that is IgE mediated. Type 2 is antigen antibody complex deposition. Type 3 is your type 2 is antibody reaction. Type 3 is antigen antibody complex deposition. So fibrinoid necrosis, polyarteritis nodosa, all are generally examples of type 3. There is deposition of immune complexes. And type 4 is delayed, generally seen in tuberculosis. Following is a benign tumor, H mole, lymphoma, melanoma, seminoma. Now, all of the following, H mole, lymphoma, lymphoma, melanoma, seminoma, though they end with oma, these are exceptions. All of them are malignant tumors. So the answer here should be H mole because of the placenta. One second. What was I saying? H mole, right? So H mole is basically a placental tissue benign tumor. A malignant tumor of the same name would be choriocarcinoma. Whereas lymphoma, melanoma, seminoma, all of them, even if they end in oma, the answer is these are malignant, right? Uh, Following is rarely metastasizing tumor. You need to remember two examples: basal cell carcinoma and your gliomas. Both of them are non-metastasizing but locally invasive tumors, right? Following fixative is used for electronic microscopy study of tumor. The answer is glutaraldehyde. You generally don't use formalin, you'll use glutaraldehyde. CA125, ovaries. CEA and CA125 both are very specific for ovarian carcinoma, so you need to remember that. So it's for ovary. Following clinical feature is characteristically absent in aplastic anemia. It is splenomegaly. No. In splenomegaly, why is there splenomegaly? Because when there is destruction of RBCs. In aplastic anemia, there is no formation of RBCs. So the answer is A, splenomegaly. You'll see reticulocytopenia. Yes, all penias will be there. Neutropenia, macrocytic pneumonia. Generally, you may see precursors, but splenomegaly is definitely not present. Christmas disease, hemophilia B is an eponym name after. Now they say that Christmas disease is it is basically because of one sec. So it is named after the first patient, which was Stephen Christmas. It's not after a holiday or a tree. It is named after a patient. Christmas disease, Stephen Christmas. Right. So now we'll go to winter 2014. Programmed cell death is also known as one second. Yeah. So programmed cell death, also known as apoptosis. Liquefactive necrosis is seen in. I'm having some issues here with the laptop. Right. Liquefactive necrosis is generally seen in brain, right? In liver, in heart and liver, generally you see coagulative necrosis, but in brain you will have liquefactive necrosis because the brain is rich in enzymes. Immunoglobulin involved in type 1 hypersensitivity reaction. Now, so type 1 is generally because of right? Type 1 is because of IgE mediated. Acute inflammation, pain is mediated by, right? In acute inflammation, pain is generally mediated by bradykinin. Pale infarct not seen in. You should always find those organs which will have a dual blood supply, such as your GIT. You'll have ovaries, and you'll have your uh, lungs. So the answer is lungs. Laminin is seen in, remember, it is basement membrane. Example of tumor suppressor gene. Now see, NMIC, you might have heard, FOS, TRAS, all of them are anti-apoptotic genes. That means they will promote tumor formation, whereas RB is an anti-apoptotic gene. And RB, when RB is famous for retinoblastoma, Knudson's two-hit hypothesis, that one hit is before and one hit is after. The environmental insult results in a second hit, and that results in formation of eye tumor, which is known as retinoblastoma. What are hamartomas? Hamartomas are basically I have told you. These are developmental malformations which are there. Basically, ectopic name. At the same location, you will have malformed cells. So these are known as your hamartomas. Opsonins are, now opsonins make the antigen or the bacteria more tasty, it's said, or more appropriate for phagocytosis. So the opsonin is C3b. C5a is for chemotaxis, C3b is an opsonin, remember it. Most common malignancy in AIDS is, answer is Kaposi's sarcoma, right? Macroglossia is generally seen in amyloidosis. Cause of ITP is antibody to platelets. Immune thrombocytopenic purpura. Immune thrombotic thrombocytopenic purpura. Basically, you have antibodies which are directed against your platelets. Gamma antibodies, I told you earlier, it is seen in CVC, spleen. AML is characterized by OR rods. Philadelphia chromosome is characterized in CML. Russell's body are found in plasma cells seen in multiple myeloma. Basically, these are protein ingested plasma cells. Right, protein ingested names, the plasma cells will generally produce antibodies. So these are collection of these light chains which are there in those plasma cells. Marker for B lymphocyte, CD19. You'll just have to remember it. There's no other option for it. Enzyme which prevents aging. Now this is your chromosome. At the end, you will have telomerase enzyme. So telomerase enzyme generally regenerates your ends of chromosomes as it replicates. But when there is absence or deficiency of telomerase, what happens is your chromosomal ends will simultaneously decrease, and that will result in aging process. So to reverse aging, you will need something which will promote telomerase. So it is said that green tea or catechins in green tea, they'll generally promote the activity of telomerase. HIV contaminated waste products can be decontaminated by all. So you can use either alcohols, you can use aldehydes, but you generally don't use sodium hypochlorite. Sodium hypochlorite is generally used for cleaning your floor. But HIV infected, you use alcohol and aldehyde. Diabetic foot is an example of, now see, diabetic foot exclusively is an example of dry gangrene, but when it is infected, it may become wet gangrene. Why infection? Because there is abundance of glucose, which is a good medium for bacteria to grow. So if I would be there, I would mark the answer as dry gangrene. Cardiac amyloidosis also often produces, you just need to remember, it is restrictive cardiomyopathy. Nephritic edema differs from nephrotic edema. See, nephrotic is a very high proteinuria, and you will have a widespread edema, and it will generally appear as puffiness over your eyes, on your face, whereas nephritic is generally relatively mild. So the answer is mild edema. Distributed on face, eyes, heavy proteinuria, acute glomerulonephritis. All of the following are seen in nephrotic syndrome, not in nephritic syndrome. Right. Most common cause of pulmonary embolism is your DVT or deep vein thrombosis, because from the superficial veins, from the deep veins of the leg, it can go to the superficial veins, and from the superficial veins up to your right side of the heart and in your pulmonary vein. So it can cause a thrombus, right? Antlers thrombus it is called, because it appears like a V shape, right? Most common cause of pulmonary embolism, DVT, deep vein thrombosis. Which of the following acts as a chemokine? Now, what is a chemokine? A chemokine is a chemotactic cytokine. So I told you the answer, it has to be C5a. So the answer here is C5a. Typhoid fever is an example of acute inflammation. That is not chronic, it is acute. Which category of leprosy is not included in Ridley-Joplin classification? I have mentioned it in my video on inflammation. So in Ridley-Joplin, you will have generally 5 categories. At either ends, you will have TT and LL, which is tuberculoid and lepromatous leprosy, LL. Then you will have borderline, and you will have mid-borderline. You don't have something known as indeterminate. So the answer is indeterminate. Tubercle bacilli causes lesions by which of the following mechanism? The lesions are basically due to a delayed type of hypersensitivity reaction. It is type 4 because it is not being eliminated. It's a chronic inflammation. P. falciparum differs from other plasmodia in the following aspects, except one red cell may contain more than one parasite. No, one red cell contains only one parasite. So this is a clincher. Causes malignant malaria, yes, and it is known as Dirk's granule. DURCK. Parasites only juvenile red cells. Yes, it's true. Does not have an exoerythrocytic stage. That is a schizonticidal stage. It may or may not have. So that's true as well. But one cell may contain only one parasite, not more than one parasite. And the RBC stage is generally known as merozoite, right? It's trophozoite, then merozoite, then schizont, right? Grading of tumors depends upon the two terms, grading and staging. Staging is basically your TNM, which is tumor size, nodal involvement, and metastasis. Whereas grading is on the basis of how differentiated or poorly differentiated the tumor is. So, is it degree of anaplasia? Yes. Rate of growth of cells? Yes. Degree of differentiation? Yes. Metastatic spread? No. Metastatic spread is for staging. It is not for grading. Mutations affecting germ cells will produce cancers. They'll produce cancers. Right. The next two questions. Drumstick appendages seen in neutrophils and stained blood cells in females are generally more than 20%. That's a fact which you need to remember. Which of the following is pro-apoptotic? Is P53 pro-apoptotic? Yes, that's why it's known as a guardian of the genome. BAC's bad? Yes, these are also pro-apoptotic. BAC pro-apoptotic. BCL2? Yes, BCL2 is also. So in CML, which is ABL BCL2 mutation. So your BCL2 is apoptotic. So that will lead to CML, right? Stable cells include all except hepatocyte, fibroblasts, vascular endothelial cells, neurons. So there are three kinds of cells: labile cells, stable cells, permanent cells. Permanent cells, non-dividing cells, your neurons. Stable cells, they'll divide if there is injury and they'll replace those cells. Labile cells, they'll keep dividing. So 1, 2, 3, all of them are stable cells. They'll divide if there's injury. Neurons, they'll not divide even if there's injury, because in neurons they'll be replaced by neuroglial cells. So CNS damage, will neurons divide? No, they won't divide. They are regenerated by neuroglial cells. One of the following conditions associated with dystrophic calcification: dystrophic, D is for dead cells, dead or damaged cells. So necrosis, fat necrosis is the answer. Primary, secondary hyperthyroidism, vitamin D intoxication, all of them will have an increased level of serum calcium. That will lead to metastatic calcification. That is calcium deposition in normal tissues due to increased calcium levels. The DIC is generally commonly seen in AML M3. You need to remember it. Paraneoplastic syndrome is most common, CA lung. And with CA lung, non-small cell carcinoma, NSC. Lung carcinoma, specifically non-small cell carcinoma. Ideal anticoagulant for platelet count. All blood studies, ideal anticoagulant is your EDTA. You'll use EDTA. Barrett's esophagus, example of metaplasia, which is your columnar metaplasia is, sorry, your squamous metaplasia is replaced by columnar gastric cells, right? So that is a columnar metaplasia. Nutmeg liver, again, it's been repeated the third time it is seen in CVC liver, which is chronic vaso congestion of liver. Frozen section is used for demonstrated of fat. Intraoperative frozen section, demonstration of fat, because fat is generally cleared by your staining methods, or your alcohol dissolves fat, so it will appear as clear. So you don't want to have a clear appearance. For demonstrating it, you will use frozen section. Which are the other stains you will use for fat? It is oil red O, Sudan 3, Sudan 4, alizarin, Sudan 3, Sudan 4, oil red O, and Sudan black. Right. Christmas disease, hemophilia B, factor 9. Hemophilia A is factor 8. Whole blood is stored at 2 to 4 degrees. From whole blood, I remember that there's again a question which is known as criteria for a blood donor. So you need to study that properly, because that is often repeated. Characteristic cell of syphilis is, it's generally a plasma cell. Syphilitic aortitis, biopsy, you'll see plasma cell. Cause of edema and nephrotic syndrome. What causes edema and nephrotic syndrome? There is large scale loss of proteins. So the answer is hypoproteinemia. Stain used to visualize iron in tissues. Iron, wherever you see iron, it is Prussian blue. All of the following are examples of autoimmune disease. Rheumatoid, yes. Osteo, no. Osteo is a degenerative disease. Scleroderma Sjogren syndrome, yes. Both of them are autoimmune diseases. Osteoarthritis is a degenerative disease. 4 cardinal signs of inflammation, they were first described by Celsus. And the fifth one, functional was added by Virchow. Mechnikov, I told you, was autophagy. Not autophagy, autophagocytosis. Most important mediator of chemotaxis is C5A. Most important opsonin is C3B. Next, Barrett esophagus, example of metaplasia. Which metaplasia? Columnar metaplasia. Granuloma formation, tuberculosis, remember, type 4 hypersensitivity. Bone marrow hematopoietic cells are known as labile cells because they keep on dividing. Edema and Kwashiorkor. In Kwashiorkor, what happens is, Kwashiorkor is protein energy malnutrition. O से याद रखना है edema. That means your baby will be edematous, or he'll have basically peritoneal effusions or ascites. And why is that? Because there is decreased protein intake. So there is reduced plasma oncotic pressure. That's why there is more transudation of fluid. So reduced plasma oncotic pressure. Following statements about CML are true except Philadelphia chromosome detected in all cases true. BCR-ABL fusion gene directs synthesis of abnormal oncoprotein true. Why? Because ABL itself is an oncogene. Leukocyte alkaline phosphorate activity is reduced? No, it is increased. So this option is incorrect. The answer given behind is incorrect. Extramedullary hematopoiesis leads to splenomegaly. That's true as well. Why? Because there is ineffective hematopoiesis. That's why you have extramedullary thing. The next questions. Wear and tear pigment, as I mentioned you, wear and tear pigment is your lipofuscin. Hemodialysis associated amyloid, it is beta 2 microglobulin. Light chain is with respect to myeloma. Myeloma is, you'll see, light chain. Amyloid, SAA, right, and transthyretin, yes. So there's a table which amyloid is seen where. I want you to go through that table because MCQs are frequently asked. Among chemical mediators of inflammation, arachidonic metabolites include all except thromboxane, yes. Leukotrienes, lipoxins, yes. Lipoxins are basically LOX. Thromboxane is also LOX. Leukotrienes are LOX, which is lipid oxygenase. Kallikrein, no. Kallikrein is derived from complement. RBC cytoskeletal membrane protein defect is seen in so sickle cell disease, thalassemia, G6PD, all of them. G6PD is an enzyme defect. It's not a protein defect. Sickle cell and thalassemia are hemoglobin defects. Spherocytosis is a membrane defect. So the answer is spherocytosis. Autosomal dominant, spectrin mutation. Spectrin and ankyrin. Major co-receptors on target cells for binding of GP120 is GP120 you generally see for CD4 count. CD4 count less than 200 is suggestive of a severe immunodeficiency in AIDS. White or pale or anemic influx. See, all of the following are the same terms. So you'll see it in solid organs. Is lung a solid organ? Small intestine? No. Ovarian? No. Kidney? Yes. So kidney, spleen, heart, all of them are white or pale influx. HDN or hemolytic disease of newborn is due to when an Rh negative mother has an Rh positive fetus in the first pregnancy and the second pregnancy. It will lead to HDN. So the answer should be Rh positive baby, mother is Rh negative, first baby Rh negative, no, first baby Rh positive. So again, Rh positive baby, mother Rh negative, first baby Rh positive. Answer is option D. Under appropriate storage conditions in blood bank, shortest half-life. So which thing has to be used the first? Platelets. Platelets are the shortest half-life. You'll have to use them first. Lab anticoagulant for ESR in Westergreen method. In Westergreen method, you will use double oxalate. In Wintrobe, so Wintrobe it ends with E. So Wintrobe के लिए याद रखना EDTA and Westergreen के लिए याद रखना double oxalate, ammonium and potassium oxalate. So answer is double oxalate. It's not Westergreen. Westergreen, Wintrobe is EDTA and Westergreen is double oxalate. All of the following are CMDs, which is chronic myeloproliferative disorders. Essential thrombocytosis is not myeloproliferative. All of them, polycythemia vera, myelofibrosis, MDS, myelodysplastic syndrome, these are myeloproliferative. Essential thrombocytosis is not. Karyotype 47XXY, Klinefelter syndrome. No brainer. Repair of necrosed neuroglial tissue. Now, I've told you that in CNS, neurons, do they divide? No. So these are replaced by your neuroglial cells. Proliferation of neurons is incorrect. Major effects of IL-1 TNF except fever, neutrophilia, increased proliferation of fibroblast, chemotaxis? No. The increased proliferation of fibroblasts is seen in chronic inflammation. IL-1 and TNF are acute inflammation. So you'll have A, B, and D, not C. Answer again given behind is incorrect. Bilateral hilar lymphadenopathy, non-caseating granuloma, generally females. Non-caseating bilateral hilar, answer has to be sarcod. It cannot be anything else. Apoptosis is inhibited by, what will inhibit apoptosis? BCL2. BCL2, MCL1 and BCLXL. All of them are anti-apoptotic genes. RAS, NMYC, CMYC, P53, all are pro-apoptotic. Right. Right. One sec. So when you have a mutation in A, C, and B, you'll have cancers. Dystrophic calcification is observed in all except TB lymph node, gamma antibodies, yes. Gastric mucosa, no. Gastric mucosa, metastatic calcification because it is normal mucosa. Atheromatous plaque, yes. HLA-B27, without doubt, ankylosing spondylitis. Amyloidosis and long-term hemolysis, without seeing the option, you should know the answer. It is A beta 2M. Right. A beta 2M. Yeah. B amyloid, A beta is generally seen in senile. And the answer is Alzheimer's dementia. You'll see A beta. 40 years old female immobilized for fractured femur, suddenly developed dyspnea. See, I've told you long bones generally have fat in the marrow. So in fractures, you'll have fat embolism. So the answer has to be fat embolism. The fat has maybe embolized to her pulmonary vessels, and that is causing her dyspnea. All statements about F falciparum are true except red blood cells increase in size, yes. Multiple parasites seen, no. So this is repeated for the second time. Only a single parasite is seen. Dirk's granuloma seen in brain, yes. Malignant malaria. All stages of erythrocytic schizophrenia may not be seen. That is true. Father has sickle cell disease. That means he is homozygous. Mother is normal, which is homozygous but no trait. Basically, she'll not have that defective gene. Chances of children having sickle cell trait and sickle cell disease. Now, sickle cell disease will only manifest in when the person is homozygous. If it is heterozygous, it is trait. Now, so father having HBS, and mother having only HB. So the children, all of them will have HBS. So all of them will be trait, but will any one of them have disease? No, none of them will have disease. So 100% trait and 0% disease. Which treatment is false about Marfan's? Lack of fibrillin, yes. Ligaments are lax. Bilateral subluxation of limbs, yes. Associated with MS? No. It is associated with MR. It is associated with mitral prolapse. Which one is not a manifestation of internal malignancy? Acanthosis nigricans is yes. Erythema nodosum, migratory thrombophlebitis. All of them are indicators of basically your pancreatic malignancy. Dermatomyositis is no. It is an autoimmune disorder or a rheumatic disorder. Yeah. M spike in multiple myeloma generally seen because of light change or rods characteristically seen in AML. AML M5. Yes. Vitamin K deficiency diagnostic investigative finding is your PT will be prolonged. Prothrombin time will be prolonged. Yes. You need to remember it. Vitamin K, PT prolonged. APDT is intrinsic pathway defect. DIC, disseminated intravascular coagulation, most commonly occurs in amniotic fluid embolism. It is not air, thrombo, or fat. It is generally amniotic fluid embolism. Next, summer 2017, only 3 papers left. Metastatic calcification occurs in hyperparathyroidism. Yes, there is increased serum calcium. Caseous necrosis, atherosclerosis, no, you'll have dystrophic. Type of embolism includes fat. Water does not embolize, neither does protein nor does carbohydrate. Fate of a thrombus includes all except can it be propagated? Yes. Can it be organized? Yes. Can it dissolve spontaneously as well and with thrombolysers as well? Yes. Amplification? No, it does not amplify. Main cytokines acting as mediators of inflammation are all except interleukin 1, TNF alpha, yes, nitric oxide, interferon gamma, basically all of them are mediators of inflammation. Nitric oxide is generally used in anti-inflammation. It's not pro-inflammatory, it's an anti-inflammatory mediator. So the answer is anti-inflammatory. G6PD deficiency is your X-linked or sex-linked recessive. Primary site of iron absorption, duodenum. See, iron is absorbed in duodenum, B9 is absorbed in jejunum, and B12 is absorbed in ileum. DJI. Duodenum, jejunum, ileum, iron, B9, B12. Oncogenic RNA virus, again a repeat question has to be HTLV, human T cell leukemia virus. Receptor for IG is present on, see, IG is produced by your eosinophils and receptor is present on mast cells or your basophils, which will release histamine. So the answer has to be basophils. Wear and tear pigment, lipofuscin, RH, wait. Extracellular change. or extracellular hyaline change is generally seen in, see, Russell's bodies are intracellular, Mallory Dank bodies again intracellular, viral inclusions intracellular. Hyaline arteriosclerosis is extracellular deposition of hyaline material. Benign nephrosclerosis, if you might have heard. So you'll have hyaline arteriosclerosis. Answer given again below is incorrect. Answer is D. All of them. Russell's bodies, Mallory Dank bodies seen in alcoholic hepatitis, viral inclusions, Councilman bodies, Russell bodies seen in, I've told you, is seen in plasma cells which are having IgG or IgM. And that is seen in multiple myeloma. All of them are intracellular, hyaline is extracellular. RH incompatibility, direct Coombs means. What does direct Coombs test include? It includes baby's blood with RH positive baby and RH negative mother. Direct is baby's blood and indirect is basically baby's seed, right? Coombs test is generally for baby's blood only. It is only done in baby's blood. When it is direct, you'll see basically you want to rule hemolytic disease of newborn. That's why you do an RH positive baby in an RH negative mother. Test for platelet function is bleeding time. It's not clotting time, it's bleeding time. Increased vascular permeability by endothelial cell retraction and contraction is, so in inflammation, there is exudation of fluid generally from post capillary venules. So answer has to be venules. But arteriolar dilatation leads to heat, but venular dilatation leads to edema. Most common form of amyloid in third world countries is primary amyloid. Remember it. Typhoid, peripheral blood shows leukopenia with lymphocytosis. Venous thrombus, venous emboli generally from the DVT, deep venous veins, into your pulmonary vasculature. Following is an AIDS-defining lesion, CMV. CMV retinitis or CMV encephalitis. Both of them are AIDS-defining opportunistic viral infection. Major fibrillary protein in secondary amyloidosis. Secondary amyloid is amyloid AA, right? Lepromin test is strongly positive in, so lepromin test is delayed hypersensitivity reaction. So if there is better immunity, the test will be strong. Poor immunity, test will be weak. So the best immunity or better immunity is generally in the tuberculoid forms of leprosy, not in the lepromatous form. So there is only one option which is having tuberculoid form, and so the answer has to be TT, right? Kupffer cells shows following type of pigment. So hemozoin is the pigment. The RBCs, malarial parasites degrade hemoglobin into hemozoin. The answer is hemozoin. Tuberculin reaction is type 4. Manifestation of secondary syphilis, need to remember very carefully. Primary syphilis is chancre. Secondary syphilis, you'll have condyloma latum, or it may be latent, and or lymph node involvement. And tertiary syphilis, you'll have tabes dorsalis. You'll also have syphilitic aortitis, saddle nose and all. So that is all. Chancre is primary, B and C is tertiary, condyloma latum is secondary. Following syndrome is cytogenic disorder involving sex chromosome. Down, Edward, Turner, Puthoff has to be Turner. Turner is 45XO. What is down? I can hear you. It is trisomy 21. Edward, trisomy 18. Puthoff, trisomy 13. Following is an autosomal recessive disorder. Which of the following is autosomal disorder? Hemophilia, no. X-linked recessive. G6PD, X-linked recessive. Sickle cell, autosomal recessive. Hereditary spherocytosis, autosomal dominant. Mark's splenomegaly is a feature of, in which one will you see Mark's splenomegaly? CML, right? Any chronic condition you see CML, not in acute condition. It has to be chronic myeloid leukemia. Leukematoid reaction shows, what will leukematoid reaction show? It will show a raised leukocyte alkaline phosphatase, right? Following is a hemoglobinopathy. Hemoglobinopathy, which one of the spherocytosis is a protein defect. Megaloblastic anemia, it is again a hemoglobin production defect, right? But hemoglobin is still the same. Thalassemia major is again somewhat similar because there is a globin defect. So sickle cell disease, you'll have a change of HbA to HbS. So that is a hemoglobinopathy, not thalassemia major or megaloblastic anemia. Right. Multiple OR rods seen in, OR rods generally seen in M3 in myeloblast. AML. Metaplasia is a cellular adaptation. It can be a precancerous lesion, but it can progress to cancer, but better answer would be a cellular adaptation. Single organ autoimmune disease, I'm not pretty sure. They have given the answer as rheumatoid arthritis, but please do recheck. Staging of cancer. So grading and staging. Grading is based on differentiation rate of cell growth. Staging is T and M. So tumor size is T. N is node, and M is metastasis. So the answer here has to be tumor size. Krukenberg tumor is transcelomic spread of a breast carcinoma to your stomach. That is known as Krukenberg's tumor. Right. So 16th is, the answer has to be basically D. It is not C. Answer is D. Transcelomic spread. Irreversible cellular injury is indicated by accumulation of amorphous calcium deposits. Large amorphous calcium densities in mitochondria is an example of irreversible cellular injury. Regeneration is replacement of lost tissue by your living tissue of similar kind. That means regeneration. Granular tissue is not regeneration. Granular tissue is post-inflammation, which is repair. Granulation tissue is repair, and living tissue of similar kind is regeneration. Immunoglobulin involved in type 4 hypersensitivity, IgE. All of the following are mediators of inflammation except TNF alpha, yes. Interleukin 1, prostaglandins, yes. Myeloperoxidase, no. It is involved in basically your phagocytosis. True about integrins is used in binding, oncogene, anti-oncogene, component of basement membrane. Answer is used in binding. Component of basement membrane is laminin. Phagocytosis was first studied experimentally by Mechnikov. Pale infarct not seen in lung. Then your next, one sec. Alcohol keratin is composed of your pre-keratin filaments. Answer has to be pre-keratin. Versus triad and endothelial injury, stasis or altered blood flow, hypercoagulability, yes, not platelet thrombus. So answer is D. Simple bacterial test for mutagenic carcinogenesis, AMIS test. Now what is AMIS test? Is basically you'll have Salmonella typhi, which were histidine producing negative, but when you apply the carcinogen, they'll turn histidine positive. This is in short your AMIS test. Your carcinogen which converts histidine negative salmonella to histidine positive salmonella, that is your AMIS test. Simple bacterial test for mutagenic carcinogen, AMIS test. Known as guardian of genome, P53, pro-apoptotic. Which of the following tumors alpha fetoprotein is elevated? Alpha fetoprotein generally, remember, it is generally for yolk sac tumors, and the answer here should be choriocarcinoma. All of the following are tumor markers except SCG, yes. Alpha fetoprotein, yes. Beta microglobulin, no. It is seen in amyloid with chronic hemodialysis. CEA, yes. Deficiency of intrinsic factor, B12 deficiency, will lead to pernicious anemia. Yeah. Intravascular hemolysis is generally seen in sickle cell anemia. Hereditary spherocytosis is spectrin defect. Spectrin and ankyrin both. Last two papers, following is true about anti-RH antibodies. They are, what is true? They can be demonstrated by Coombs test. Yeah. They are naturally present in RH negative person. No, they won't be present. Predominantly IgG type. No, it's IgM type. Can cross placenta. No, cannot cross placenta. Decompression sickness, Kazan's disease is because of air embolism. When a person goes from in a deep sea divers, when they go from bottom to the up, there will be decrease in pressure, and as a result, your gases will be formed, such as nitrogen. So nitrogen is basically the gas seen in Kazan's disease, decompression sickness. Example of granulomatous disease is leprosy and tuberculosis, not typhoid. Typhoid is acute, acute. Viral hepatitis acute. Tissue renewal and repair, example of labile cells. Labile cells is basically those which will keep on dividing. So it has to be your bone marrow hematopoietic cells. Klinefelter syndrome, 47XXY. Sarcomas usually slow. Now your carcinomas will generally spread by lymphatics, and sarcomas will generally spread by your hematogenous route. Pathophysiologic categories of non-inflammatory edema include all except increased hydrostatic pressure, yes. Reduced osmotic pressure, yes. Increased capillary permeability, no. That is for exudate, which is an inflammatory type of edema. White or pale infarcts generally seen in, what should be answer? Kidney, spleen, heart, except lung. Peripheral vasodilation and DIC commonly seen in septic shock. And if septic is not given, you will go for amniotic fluid embolism. Autoimmune disorders include all except lupus, Hashimoto's, Sjogren's, and which is next is muscular dystrophy. No, muscular dystrophy is an genetic disorder. It is not autoimmune per se. There is a protein defect. There is no antibodies against those proteins. It's a defective protein synthesis. Serum alpha fetoprotein, yolk sac tumor, which is answer C. 11th is C. Following is true about fatty liver, alcohol abuse common. Again, this is the fourth time repeat. Cholesterol accumulates in hepatocytes? No, it is triglycerides. Malarial parasite growing in erythrocyte are known as merozoites. Right. Water soluble vitamin KEDA. These are fat soluble. KEDA. Water soluble is C. C and B. Example of dystrophic calcification is atherosclerosis. Because dead tissues, calcium will be accumulated. Hypovitaminosis D, hypoparathyroidism, primary and secondary both. Paget's disease, all of them are metastatic calcification. HIV infection, CD4 is GP120. Remember it. RH incompatibility with hemolytic disease of newborn is RH negative mother, yes. First and second both have to be RH positive babies. Following is true about dystrophic calcification. Serum calcium level normal, yes. Calcium deposit seen in normal tissues, no. This is incorrect. It is seen in dead or damaged tissues. Special stains, which is the special stain? Alizarin red is one of von Cosa. Alizarin red. These are special stains. Occur intracellularly and extracellularly? True. Langerhans cell is a type of giant cells. So it is basically a histiocyte. Wound healing by secondary intention, wound contraction occurs due to contractile activity of myofibroblast. In primary intention, it is generally fibroblast, which is a very decent wound or a clean wound. But in secondary intention, it is myofibroblast. Right. And autosomal dominant disorders, what is true except mutations affect structural regulatory proteins? True. Include most inborn errors of metabolism? No. Most inborn errors of metabolism are generally autosomal recessive. They are not autosomal dominant. Otherwise, everyone would have them. Reduced penetrance and visible expressivity? Yes. Clinical onset may be later? Yes. Longitudinal intestinal ulcers and inflamed Pierce patches are seen in typhoid. Typhoid is salmonella. Liquefactive necrosis seen in brain. Decompression sickness, deep sea drivers, air embolism, Casen's disease, nitrogen. Choristoma means, now what is choristoma? Normal cells, abnormal location. So ectopic rest of non-transformed tissue, that is choristoma. Disorganized tissue indigenous to particular site is hamartoma. Following are examples of intracellular hydrogen chain. Vessel body, yes. Malaria, yes. Viral inclusions, yes. What's the exception? Amyloid. Amyloid is extracellular eosinophilic amorphous material. Brown atrophy of heart, lipofuscin, wear and tear pigment, red infarct. Red infarct kahan dikhega? Again, lungs. Eighth repeat. RBC's iron deficiency anemia is microcytic hypochronic. Major ABO incompatibility reaction includes when? Now see, your O negative is universal donor, AB positive is universal receiver. जब तुम्हारा AB वाला person donate करेगा to any person, especially O, you will have major incompatibility. So donor is AB group, recipient O group. Most definitive proof of malignancy is metastasis. Secondary to metastasis, most definitive clue of malignancy is anaplasia. Oncogenic RNA virus, HTLV. So with this, we generally end this session and do the past year MCQs well, which I've discussed. Watch it at 1.5 to 1.7. I know I'm a bit late for it, but hopefully, let's see. Best luck.